This is breaking news.
And good afternoon. The governor's daily coronavirus briefing just got started in Providence. Let's go now live to the State House.
Again, working hard and coming to you live at 1 o'clock every day, as we will be doing every day this week. 1 o'clock, tune in here to get the most accurate, up-to-date information about coronavirus as it pertains to the state of Rhode Island. Today, I'm very sad to begin my report with reporting another 10 deaths as a result of coronavirus, bringing us to a total of 73 deaths from coronavirus since we've started this virus together. We have 311 new cases in Rhode Island for a total of 2,976 cases, and we have 197 people in the hospital. I do want to remind everybody that although these numbers are increasing very rapidly, and we're now up to nearly 3,000 cases, it's not alarming, or shouldn't be alarming. It's on account of two things. One, the fact that we know we have widespread community transfer, and we've been predicting this for weeks. But secondly, we've really ramped up our testing. So, we're now testing 4 or 5 times as many people as we were a week and a half ago. So obviously, we're going to be having many more folks who are positive. And that's a good thing insofar as we have a more accurate picture of what's happening in Rhode Island. I want to start this afternoon by talking directly to business owners. I will say that the economic decisions or the economic impacts of the decisions that I have had to make over this past month weigh very heavily on me. I have spent every day for the past 6 years as your governor working hard to get people back to work. And I'm the last person who wants to be making decisions to close businesses and temporarily put people out of work. Having said that, right now, as your leader, I'm faced with no good options. The options that I'm weighing are bad option A or bad option B. And so I am doing my best to follow the best guidance and evidence and science and making decisions that will keep everybody safe and healthy and alive, do the minimal amount of economic damage in the here and now, and then do everything we possibly can to get everybody back to work as soon as possible. So I want you to know I'm not taking these decisions lightly to impose restrictions on our economy, and I have tried hard to keep as many businesses open as possible, helping you to work from home, encouraging small businesses to become more tech-enabled to work from home. And I also want you to know I begin every day, every meeting, asking the question, what do I need to do to get people back to work? What do I need to do to really start turning the switch back on? And as I've said many times, it will not be an on-off switch. It'll be a gradual switch. But it's important to me that you know it is top of mind for me, and it is my goal that Rhode Island will be one of the very first states in the country to begin emerging and getting people back to work. And everything we do is designed to get us there together. In the meantime, the brutal reality of what we're living is that there's tens of thousands of people out of work, laid off, unemployed, struggling to pay rent, struggling to buy food, struggling to keep the doors open for your business. And I hate that, and I'm sorry, and we're going to get you back to work soon. Also, I'm doing everything I can to help you out in the meantime. And I hear from you every day. The federal SBA loan program, also known as Paycheck Protection Program, PPP, is available and taking applications. That's been made available because of the federal stimulus and the CARES Act. It's a program that helps small businesses keep workers on your payroll through the crisis by providing you with forgivable loans. So you can seek a loan, and it'll be forgivable if you keep employees employed. That has been made available due to the very hard work of Senators Rhode and Whitehouse and Congressman Cicilline and Langevin. And I want to again publicly thank them for their advocacy on behalf of Rhode Island. You have to apply through an existing SBA lender. So that's a credit union, a bank, whoever your existing financial relationship is with, find an SBA lender and file an application. I will be the first to admit this is a good thing, but a far from perfect thing. I know it isn't perfect. I know that because I'm hearing from you saying that you can't get the loan, you don't know how to find an SBA lender, you don't have an existing relationship with an SBA lender or a bank or a credit union. So I have been working hard to try to figure out additional resources for small businesses. A few weeks ago, I placed a call to the senior team at Goldman Sachs. Rhode Island has had, over the past 5 years, a very good relationship with Goldman Sachs because they partnered with us to do the 10,000 Small Businesses Initiative, and we have supported over 250 small businesses through that Goldman program. I reached out to them and said, Rhode Island needs help. What else can you provide, and how do I make sure Rhode Island is first in line? And so today I'm very pleased to announce that Goldman Sachs is committing $10 million to a loan program for small businesses in Rhode Island. And I'm very happy to say that we are among the first states to be rolling out that initiative today with Goldman Sachs. The program will operate in partnership between Goldman, Rhode Island Commerce, and the Community Reinvestment Fund. So you might be saying, how do I know if I should apply? If you're a small business or a small nonprofit, if you need access to cash, you're having trouble paying your rent, trouble paying your bills, you're still getting your bills, but yet your revenue is not coming in, and you have been challenged, you can't access the SBA PPP program, I want you to think about applying for this new Goldman Sachs loan fund. Best way to do that is to go online to the Commerce Rhode Island website, which is commerceri.com. commerceri.com. Or you could call 521-HELP, which is our business helpline. But we're really trying to drive all applications through the website, so commerceri.com. So again, these are loans for small businesses and nonprofits who are really strapped for cash flow. For whatever reason, you haven't been able to get the small business PPP loan. Check this out. It's available today. Loans of up to a maximum of $250,000 available immediately, and also largely forgivable, again, if you continue to employ folks. So I hope this helps. It isn't perfect. It's not enough money. I'm going to continue to work to get more to help you. But just know this is something else, help's on the way, and it's going to help us all get through this. I want to take a minute to talk about testing. I announced a week ago or 2 weeks ago that I'm managing the all of government response to coronavirus through 10 teams. I've assembled 10 teams of experts, each managing a particular workflow. And throughout this week, I want to give you updates on where the work is in each of those 10 teams. I'm going to tell you where we are now and where I'd like to get us. So today I want to take a minute to talk about testing. Testing matters so much. I was just on the call with all the governors in the White House, talking to experts, health experts, and everyone agrees in order to get people back to work, we have to have a robust, statewide, widely available, accessible, affordable, highly accurate, fast testing scheme. That's what we're trying to get to. So that when we're all back to work, we can, if you think somebody's sick or you've been exposed, you can get tested quickly if you're positive into isolation quickly, and we never again have to shut down the whole economy. So we've been working hard on testing. I want you to know in the past week alone, we have made huge progress. For reference point, 2 weeks ago, we were doing about 500 tests a day. And at that time, I said I wanted to get to the goal of 1,000 a day. Last week, we averaged 2,068 tests per day, so double where we were the week before and double our goal. 40% of those tests have gone through our first-in-the-nation partnership with CVS, which is rapid. You wait for your test, you'll know the result within 15 minutes. So since we've started this together, we've performed more than 20,000 tests in the state of Rhode Island, and on a per capita basis, as far as we can tell, that puts us number 3 in the country in terms of our capacity to test and how many tests we've performed, behind New York and Louisiana. This is a remarkable accomplishment, only made possible due to the hard work of so many people. So I want to say thank you, and I want Rhode Islanders to know we're among the best in the nation for how many tests we're able to do in a given day per capita. Now, that doesn't mean we're done. It means we've made huge progress, but there's a lot more to do. So let me tell you where we're going next, what we're working on now, and what I hope to be able to make announcements on later this week, in the coming days, maybe early next week. The first thing is mobile testing. We know there are a lot of people in nursing homes, in senior living, in group homes, in other kinds of congregate living settings where they can't get out, so we have to bring the testing to them. So we are working on and trying to make widely available mobile testing, whereby we could go to the nursing home, we could go to a congregate care setting and rapidly do the tests. We're doing some of that now, but we need to move to a place where that is widely available. So that's our focus, and that's what I'd like to come back to you on later this week with an update on. The second thing is more inner city testing sites. So all over the country, we're learning that there are certain populations, poorer populations, people of color, people in inner cities, folks who don't have a car, people who don't have great access to public transportation. We're just not getting to them enough, and we need to, and we will. And so we're working hard to figure out how to put swabbing sites and testing sites in the community to make it easier for people to walk to in the event that they don't have a car or can't get out. So those are a couple of initiatives that we are working on to try to push our testing process forward. Relatedly, we have to also continue to build up our capacity to isolate people once they've been identified as positive. And again, that's part of the system. We have some facilities now. We've taken over some hotels, but that's another area where we're building capacity, because when when the economy comes back, we need this all to happen quickly: tested, positive, isolate. And so that's where we're moving, and that's what we're working on. A final comment on testing, which relates to today. I'm sure you can see, if you look out your window, we have terrible weather today. Between this afternoon, we are going to experience 65, 70 mile an hour winds, 1 to 3 inches of rain. As a result of that, we have had to close today all of our outdoor testing sites. I'm sorry about that. It was necessary. They'll all be reopened again tomorrow, and you should be notified today about if you had an appointment today, you're going to get a time tomorrow. You'll get a time tomorrow if you were supposed to be tested today. I will give a big thank you to the many of you who worked all day yesterday on Easter Sunday. We had to make this decision yesterday so we could batten down the hatches and protect. We have, millions of dollars of equipment in these outdoor tents. So thank you all for securing the equipment and securing the tents. And to all of Rhode Island, we'll be back up and running tomorrow. Unemployment. As I mentioned earlier, there are so many people unemployed, and we want to do everything we can to get an unemployment check into your hand as fast as possible. It's also very confusing because the federal government has created new kinds of unemployment benefits as a result of the coronavirus, So I'd like to just take a second to quickly go through again who is eligible for unemployment insurance type benefits and how you claim those benefits. I will begin by begging for your patience. In the past few weeks, we have had 144,000 Rhode Islanders file for unemployment insurance. 144,000. If you're one of the lucky ones that's still working, just take a minute to reflect on how many of your fellow Rhode Islanders are out of work right now, and on top of everything, they're struggling because they can barely pay the bills. And if you're one of the 144,000, I want you to know we're working every day, all day, to get you your checks and get this processed. Having said that, this is totally overwhelming, so I'm going to beg you for your patience and know that it could take us between 7 and 14 days to get you your check from the time that you file your application. I want you all to go online to file your application, and I want you to take extra special care to make sure that every piece of information that you put into your application is accurate, because if it's not accurate, that's what slows down the checks, or that's what slows down the process and slows down the check getting to you. If it's all accurate, we can pretty quickly file it and get the check out to you. If we have to manually check the information, make sure it's right, call you to verify, it just slows down the process. Okay, so there are 3 tracks. There are 3 ways that you can receive unemployment insurance type benefits. The first one is just standard unemployment insurance. This is something we're all familiar with. It's if you've been laid off from a job, a part-time job or a full-time job, go to the DLT website and file for unemployment insurance. And as I say, hopefully your check will get to you within a week, maybe 2 weeks. There's also going to be an additional $600 a week benefit till the end of July for unemployment insurance, added on to what you would normally receive. That's part of the coronavirus stimulus initiative. The second unemployment insurance type benefit is something the federal government created to respond to the crisis, called the Pandemic Unemployment Assistance Program. How do you get that? You can get that in one of 2 ways. One way is pretty straightforward. If you are out of work, laid off because of the coronavirus crisis, you can go ahead and file for that benefit. So that's for people who aren't usually available for unemployment insurance: hairdressers, independent contractors, gig economy workers, Uber drivers, self-employed people, small business owners, all those categories of folks that typically can't get unemployment insurance, barbers. Go to the DLT website and file for what's called PUA. You're eligible, we'll get you your check quickly, and you'll also get an additional $600 weekly until the end of July. So I was with a person the other day who said that his father was a barber and he can't file for unemployment insurance and he's really struggling. So I said, no, if even he's a barber, go DLT website, file for the PUA. He is now eligible. The third category of people who's eligible for unemployment insurance are those people who haven't been laid off, but who have been so severely affected by the coronavirus that the federal government says they are eligible also for this PUA benefit. Now, I want to caution that this is the hardest benefit to receive and will take the longest for you to receive your check. Why is that? Because these are for people who, unemployment insurance is for people who've been laid off. That's the guidance I want to give you. Federal government has said there are some people, if their doctor tells them you're too sick and the risk of being exposed to coronavirus is too high, you can't work, or if they themselves have been exposed to coronavirus, they can't work, then they also are eligible for this PUA benefit. The process to verify whether you are eligible for this benefit is arduous, and we're going to make you jump through hoops because we have to in order to comply with the federal government's guidelines, and also, candidly, to make sure there's no fraud. As of today, if you go on the DLT website, they've done a good job of clearly marking these 3 different buckets. Make sure you file in the right bucket, because you don't want to put yourself in that last bucket, because that could take up to a month to get the check. I want to say a few things. Being afraid to go to work because you're afraid you might get coronavirus is not a reason to be able to collect unemployment insurance. We're all afraid to go to work, but those of us whose businesses are open, we are the essential workers that have to continue to go to work. So I know it's difficult. I'm asking you to be courageous, to get up, to suit up, and to go to work, because we need you. If you can't work because you fall into that narrow category of people so affected by the virus that your doctor says you can't, or because your business closed, or because you've been laid off, then there's benefits there for you, and we're going to do our best to get it to you quickly. As for employers, I'm asking you all to continue to work hard, even harder, to make sure that your employees who have to work are well protected. Hand sanitizer. Do not make anyone work if they are sick. No one, nowhere, no how should be going to work if they're sick at all, period. I don't care how essential you think you are. If you're sick, you stay home until you have no symptoms. Employers, I'm asking you, if you can, do a physical check of employees before they come in to work to make sure they're not sick. Do a temperature check if you can. Make sure everybody is wearing a face cloth covering while they're in the office, and make sure there's ample opportunity for people to wash their hands, and give your employees an opportunity to work at an appropriate social distance from their colleagues. But within these parameters, if you're healthy and able to, we need you to go to work. And believe me, I know it's tough. Finally, I want to make a mention about schools. Today marks the start of our 5th week of distance learning in Rhode Island, and so I'd like to pause and thank everybody who's worked so hard to make that possible. Educators, principals, superintendents, parents, and the kids themselves. You guys are doing great, by the way. You're being creative. As far as I can tell, you're reading. Tens of thousands of you are reading every day in the month of April. Overall, it's not perfect, but it's pretty good. It's better than pretty good. So thank you for all of your great effort. Like everything in this crisis, the most vulnerable are having the greatest challenges. And with distance learning, those are the kids and parents and households who don't have Wi-Fi or don't have a computer. Now, a couple of weeks ago, we announced some really fantastic partnerships that have enabled us to provide more students with access to Wi-Fi. And through those partnerships, we've made tremendous strides, really tremendous. The vast, vast, vast majority of students, like 90% plus, do have access to Wi-Fi through the different means that we've made available. But still, not everyone does have access, and we need to do more. I said in the beginning, I'm committed to making sure every single kid has a chance to learn through distance learning. That doesn't mean 90%, that doesn't mean most kids, it doesn't even mean 98%. And if you're a kid out there who's listening to me and you're struggling, maybe there's you and your bunch of your brothers and sisters in one house and there's not quite enough internet for you to make, to get your schoolwork done, I'm talking to you. I want you to know we're on it. We're doing more, and we're going to do better, and we're going to make sure the internet gets better in your house so you can have the same chances as every other student in Rhode Island. So today, I'm proud to announce that the Rhode Island Foundation has partnered with Rhode to close the gaps, to close that last mile. The foundation's committed over $100,000 to provide computers and Wi-Fi hotspots to those children that we know are still in need. So, as I've often said, as I say every time when we roll out something philanthropically, thank you to the Rhode Island Foundation, thank you to Rhode, and if you are one of the lucky ones and you're able to make a donation to help somebody out, please go to the Rhode Island Foundation website. They have a special section, RI Education, and please donate. Any amount helps, and every one of these kids wants to learn, and it's on us to make sure they have the tools to be able to learn. I'm sure many of you are wondering when I will make announcements about the rest of the school year, and the answer is later this week. I'm talking to the superintendents tomorrow. I'm going through all the data to see how well students are doing, make sure we can reach everybody with Wi-Fi, and later this week I'll make an announcement about the rest of the school year. So with that, I'll turn it over to Dr. Nicole Alexander Scott.
Thank you, Governor. Good afternoon, everyone. To get us started, as the governor said, we have 311 new cases today. This brings our case total to 2,967. Sadly, we do have 10 additional fatalities to report as well. We now have 73 COVID-19 associated fatalities. 2 of these people were in their 50s, 1 of them were in their 70s, 5 of these people were in their 80s, and 1 was in their 90s. Our hearts and condolences go out to all of the families involved. Of these 10 fatalities, 8 were associated with nursing homes. As the governor also shared, there are currently 197 people hospitalized. A lot of people have asked us about current numbers versus cumulative numbers for hospitalizations. The number of 197 people currently hospitalized compares to 331 COVID-19 patients in Rhode Island who have been hospitalized since the start of this response. That means that we have roughly 135 people who have been discharged home from the hospital. Also, as we've been mentioning several times over the last few weeks, our close partnership continues with nursing homes, the administrators and the staff who continue to be dedicated to the residents in this important community. One of the things we are working with them on closely is protocols for screening workers and ensuring that symptomatic workers are not going to work. We all know that people who have symptoms need to stay home and recover safely there. That especially applies to our healthcare workers working in nursing home and other similar facilities. What that means then is that nursing homes are in need of staffing support. This is true across several of our congregate setting environments as well. If you are a retired nurse, a certified nurse assistant, a CNA, or any other healthcare worker who for any other reason is able to help in a nursing home right now, we need you. Please visit www.riresponds.org. Repeating it again, that's www.riresponds.org. I also want to take a moment to address a question that we've received a lot. People are asking how they will be informed about their test results. If you test positive for COVID-19, you will hear from the Rhode Island Department of Health no matter what. That is how we activate our expansive contact tracing program that we know makes a significant difference in us being able to respond to this emergency pandemic. I'll again echo the governor's mention to keep a log of all of the people that you have been in contact with, because that's where it becomes most important. A small group of people have been getting their tests at hospitals, at Rhode Island Hospital, at Kent Hospital, or the Newport Hospital swab collection sites. Those folks will be able to call us at the Rhode Island Department of Health for their results. They tend to be the smaller group of folks who are healthcare workers in one of the settings, or able to get there because they are from a nursing home or other congregate setting. If you get a test ordered from your healthcare provider and you went to a drive-up testing site at URI, CCRI, or Rhode Island College, the healthcare provider who ordered the test is who will call you with your test results. We want to make sure that that connection is understood. The healthcare provider who orders the test is the person who will have the test results to be able to give you. If you tested positive and went to a drive-up testing site at URI, CCRI, or Rhode Island College, as I had said before, the Rhode Island Department of Health will also be calling you to follow up and engage you in our extensive contact tracing program so that we can understand who your contacts were, make sure that you have the information on how to keep yourself safely isolated, and be able to reach out to your close direct contacts so that we can ensure that they start quarantine. We need to make sure that you understand, and the folks who were in contact with you, close direct contact with you, have a clear understanding of the quarantine and isolation guidance. Finally, anyone who tested at the CVS rapid testing site at Twin River Casino will get test results before they leave the site. It's a rapid turnaround, and those are how they will receive their testing results. That will also be the case with what the governor mentioned, that we are moving towards being able to get out into communities and make testing accessible for vulnerable populations and members of communities that have not been able to get to those testing sites. If it is the rapid test, you will get the testing results right then and there. However, for all of these people, if you test positive, you also will be contacted by the Rhode Island Department of Health so that we can get you started with the appropriate isolation and the quarantining recommendations for your contacts. We will continue to share this information as we go forward, but want to make sure people continue to understand where they can go to get their test results. So with that, I'm going to stop and get us started with questions.
Good afternoon. I think this first question is for you, Doctor. It is from Tom Mooney of the Providence Journal. How many of the total virus deaths in Rhode Island are now associated with nursing homes? And he goes on to ask, and why are officials no longer identifying which homes had the latest fatalities?
So we have approximately 55 deaths associated with nursing homes at this time. As we are collecting the information about unfortunate deaths and nursing homes, it takes time to make sure that we are associating it with the correct facility. What I can share is for the unfortunate deaths reported today, 4 of them were associated with Oak Hill, 2 were associated with Golden Crest, 1 was associated with Elmhurst, and 1 associated with Oakland Grove. So we can continue to provide that type of information as we receive it.
Thank you, Doctor. Next question is for the governor from Steve Alquist of Uprise RI. If the governor does not have the power to raise the wages for essential frontline workers, shouldn't the General Assembly take this up? People are risking their lives and the lives of their families. Why not convene the General Assembly?
Yeah, thank you. So I do agree with you that those low-wage essential workers, healthcare workers, grocery store clerks, et cetera, who have to continue to go to work are they're working hard under difficult circumstances and potentially exposing themselves to the virus. The best way to handle that, I believe, is for the federal government to provide them with a wage subsidy. And I'm working with our federal delegation in order to make that happen. I just recently today, I'm advocating to the Trump administration and Treasury Secretary that they make that a priority. In the same way that the Congress has provided $600 a week extra in unemployment insurance, the same should be done to enhance the wages of people who have to go to work. You know, we're helping out folks who've lost their jobs, which is a great thing. We also need to help out people who are still working. And so I don't think it's as simple as passing a Rhode Island state law to tell employers, all of whom are struggling themselves, that they have to increase wages. What has to happen is the federal government should subsidize wages to properly compensate low-wage folks who have to go to work under these tough conditions. And I remain hopeful that that's going to happen, and I'm going to keep fighting for that.
Brian Crandall from NBC 10 asks, can you clarify quarantining for people who live in Rhode Island but may do their grocery shopping just over the line in Massachusetts? Do they need to quarantine after going over the state line for a short time?
Yeah, the answer is yes. And again, these questions, I appreciate the question, but right now until May 8th, we are imposing the strictest interpretation of these rules, and we shouldn't be asking ourselves, how do I push the limits? How do I get out from under the rules? Could I just break the rules a little bit? We should be saying to ourselves, how can I try harder to obey the rules? We have a chance right now. The social distancing measures that we've taken, which I grant you are extreme, are really beginning to work. And so if you can just hang in there a little bit longer, it's until May 8th, I am hopeful that they will continue to work until then, and then we can get us to a place sooner that we can start relaxing these. So short answer, Brian, is yes. I know it's a pain, it's an inconvenience. We're trying to contain folks in Rhode Island, and so if you have to do your grocery shopping in Massachusetts, then you're quarantined.
Next question is for Dr. Alexander Scott. You did mention a little bit of this in your remarks, but Ryan Belmore of What's Up Newport is asking if you can clarify why the Department of Health isn't sharing a number for recovered and why we haven't seen data based on race, ethnicity, or zip code.
We are working towards having the number for recovered readily available. It is a calculation that has to occur. I shared earlier all of the people who have been discharged from the hospitals. We know the total number of cases that we have. That total number has to be subtracted from people who are still in the hospital and people who have unfortunately passed away. The number that remains would be those who recovered after 2 weeks of time. And so 2 weeks ago, when we had numbers, the total was a lot less than what we have now. So we're waiting till we have enough numbers to be able to share that calculation on a regular basis so that it's something that people can respond to. But we know overall that it's the total number of cases minus the people currently hospitalized and minus those who have unfortunately passed away with that 2-week time period that it takes for someone to really get through an illness and recover. The race ethnicity data is something that we have also been working diligently on. Every state has needed to come up with creative ways to be able to compile this information. And I really want to acknowledge tremendous work that armies of people are doing with our data at the Department of Health, and that's the lead for across state government. Some of the preliminary race data and ethnicity data that we have is of the cases that we've collected information on, those who are Latino from any race are about 10% of the cases. Those who are African American, non-Hispanic, are about 3%. Those who are Caucasian, non-Hispanic, are about 10.9%. And the remaining races, non-Hispanic, are about 1.4%. A majority of the cases we are still working through creative ways to getting the race ethnicity data, but we know regardless, the numbers that we're seeing nationally and what we are aware of here emphasize the importance of addressing the social, economic, and environmental factors that are contributing to why you are seeing these gaps among various racial and ethnic groups, as well as other populations, low income, those who are immigrants. We need to really focus on those communities. The Health Equity Zone's infrastructure is one that's designed to help us be able to do that, and those are the types of strategies that we are looking to advance so that we address it regardless of what this data shows.
Thank you. Governor, the next question is from Jim Hummel of the Hummel Report. He says, we have heard that tenants right now are being protected from evictions, but what about renters who have landlords that don't provide what they're supposed to, such as hot water? Who do the tenants go to for relief when the courts are closed?
Yeah. So first of all, landlords shouldn't be doing that. So if you are, I'm asking you to stop it. It's not right to take advantage of people as we're going through this crisis. Secondly, if you're a tenant and that's happening to you, call me. Call the governor's office, send an email to the governor's office, and we'll get on it and help you. I will say the courts are open for emergency or necessary matters. They're just they're not open for routine matters. So depending on the circumstances, if it's something that's really an emergency, the courts would be open and they would handle it.
Next question's for Director Alexander Scott from Tony Mendez of Pother 102.1 FM. What is not being documented in this coronavirus crisis that you wish was being tracked or documented?
That's an interesting question. There's a ton of information that's flowing. And being able to understand the root causes that are contributing to some of the race, ethnicity data differences that I shared earlier, and being able to really respond to the needs of our vulnerable population is a data point that we are working to continue to unpack and better use to help us inform our response so that we can continue to do a better job making sure across the board that we are equitably responding to everyone's needs within this pandemic.
Next question is for the governor from John DePietro. It's been reported that you will be part of a joint news conference later today with governors from New York, New Jersey, Connecticut, Pennsylvania, and Delaware regarding a coordinated response for a reopening plan. Any thoughts to a separate effort with Governor Baker and Governor Lamont?
Yes. In fact, probably most important is with Governor Baker, since we in Massachusetts share a number of very large employers. Many people commute between the states every day to go to work. So Charlie and I have been in contact, our teams are in contact, in addition to this effort today. I will say there is no formula around how to reopen the economy. None of us has ever lived through this before. So I don't know that we'll all do it exactly the same way, but these sorts of discussions are incredibly helpful for us to share information and share data as we together get our place to some sense of best practices around how to do this. But I'm definitely in close contact with Governor Lamont and Governor Baker.
Michael Bilo of Motif Magazine asks, Rhode Island is working with Salesforce on contact tracing. A lot of rapid work is ongoing to make a smartphone app that pings nearby devices via Bluetooth while protecting privacy using DP3T or other protocols, with Google and Apple collaborating. Is Rhode Island involved in any of this research? Yes, we are.
In fact, we reached out to Google over a month ago to ask them if they would help us build these sorts of apps. The solution that we ultimately roll out will, first of all, it will be incremental. So we'll roll out a version 1, which is has kind of minimum requirements, and then a version 2, which will have maybe a slick interface, and everything could be done on your phone, and then maybe we'll roll out something else with more advanced functionality, as you describe. The way we're doing this is we're not really building anything on our own. We're patching together a variety of off-the-shelf software and just trying to customize it for Rhode Island and make it as easy to use for the consumer as possible.
Steve Klampkin of WPRO Radio says you mentioned testing as one of 10 teams working on the coronavirus response. What are the other 9?
This is a quiz, Steve. So I have one working on procuring PPE. We have another one working on our hospitals and the hospital surge programs. I have another working on the stimulus and how will we allocate properly the stimulus funds in the best interest of Rhode Islanders. I have one on data, one on modeling, one on contact tracing, the question we just had, one on quarantine and isolation, and I think that might be it. Tech. Oh, a tech team, what we just talked about. So a tech team. And this week, I'm going to give an update on each one.
Tanya Signori of the Rhode Island Echo asks, the numbers of both hospitalizations and positive cases is a cumulative number. Some individuals have recovered and others have been discharged from the hospital, hence these are not the current numbers. Can the public start having more current numbers? Can this be done on a once or twice a month basis?
We are absolutely giving current numbers and absolute data. Each day when we are talking about current hospitalization numbers, it is not the cumulative number. We are actually giving who is currently in the hospital. So we're doing better than once or twice a month. We're doing it every day. Currently, there are 197 people who are in the hospital.
And our last question today is from Nancy Thomas of RI News Today. Massachusetts is using the Battelle mask sterilization process with 4 trailers operating around the clock at a facility south of Boston. Could Rhode Island partner with them to provide sterilization for our masks? And are there any Rhode Island, Massachusetts partnerships happening?
Absolutely, Nancy. We are ahead of you with that. We've already engaged with Massachusetts and absolutely are taking advantage of the sterilization process. We need all tools in our toolbox to help us be able to extend the personal protective equipment that we know is so critical for our healthcare workers to be able to have. Thank you.
Thank you, Doctor. Take care.
I forgot to say the new normal. That's the 10th work stream. So we have a big team working on all the details required to get everybody back to work, industry by industry. So thank you.
So that concludes today's briefing. Another 10 deaths have been reported for a total of 73 now in the state. 8 of those deaths in nursing homes. There are just under 3,000 positive cases now in the state. Goldman Sachs committing $10 million to small business loans here in Rhode Island. The governor is working to bring mobile testing to nursing homes and congregate communities as well. Also working to get testing sites in inner city areas. So far, 144,000 Rhode Islanders have applied for unemployment benefits. We're going to break down all the types on our website, WPRI.com. If you're eligible, you can find that information there as well. Rhode Island Foundation committing more than $100,000 to the Department of Education to make computers and Wi-Fi available to students who don't have it. Right now on our website and the WPRI News app, we have minute-by-minute updates on new restrictions and cancellations as well. Before we sign off, we do want to check in with Chief Meteorologist Tony Petracca. We are under a severe weather alert. Tony, what's the latest?
Well, Pat, really the worst of the storm kicking in right now through the early evening hours. The high wind warning remains in effect for the entire area, shaded in red. Now through 10 o'clock this evening. It actually kicked in about an hour ago. Wind gusts, this is a likely number right here, between 50 and 65 miles per hour, but the slight risk of isolated gusts between 70 and 75. We've had reports of some sporadic power outages. The latest number I saw from National Grid was about 1,500. I've seen some reports of wires down in situ Scituate and up towards the Foster, Gloucester area as well. And we do expect those outages to increase, along with the wind. At times, very heavy rain. We've seen nearly 3/4 of an inch of rain, and there's more off to our south and west. The core of the rain and the wind located across Long Island and Connecticut right now, and getting some reports of at least some minor street flooding. So the timeline on this, the worst of the storm is now through about 6 o'clock in the evening, some of the strongest wind and heaviest rain. But even during the early evening hours, still some weather issues to go through, but probably the core of the worst of the weather is during this time frame now through about 7 o'clock this evening. We're getting rainfall amounts now almost closing in on 1 inch of rain in Providence over a short amount of time. So the rain is blowing sideways, some localized street flooding. We're keeping an eye on local rivers and streams. The wind gusts, the areas in purple, increasing off to our west. So these numbers will continue to ramp up over the next several hours, and while we do anticipate more power outages and some wind damage. So just more of the same now through the early evening hours. The rain blowing sideways, Pat, upper 50s, and these wind gusts at times between 50 and 70 miles per hour. A wealth of information also on our website at WPRI.com. And, of course, more weather coming up on Eyewitness News starting at 5, Pat.
All right, thanks, Tony, and thanks for joining us. As Tony mentioned, for the latest weather forecast, you can log onto our website. Our next newscast is at 5 o'clock tonight, right here on WPRI 12.
Stay with Eyewitness News for the latest on this breaking story.